Morning. My name is Dr. Hillel Mazansky and I'm coming to you today from San Diego, California. I specialize in medical hypnosis, guided imagery, nutrition and exercise. My website being gianinc.com. The subject of today's health tip is, do you worry too much? Well, in everyday life, people tend to worry about their family, about finances, job security, etc. But when this worry becomes pathological or in excess, it's known as general anxiety disorder or GAD. People with this affliction are constantly worried and tense. Oftentimes they don't even know the cause of this. Women are twice more affected than men. There is a genetic preponderance together with the surrounding area and everyday life. This can be very disturbing for the sufferer who has GAD, and there are various treatments that are used. Counseling, especially in the form of cognitive behavior therapy. This is a special form of counseling where the patients write down and do homework. They write down their feelings and what they were doing, and this type of therapy is extremely good. If that doesn't work, antidepressants can be used as well as anxiolytic agents. But be cautioned, these have got side effects and they can become addicted. People with GAD, in order to minimize their symptoms, should avoid having alcohol or drugs or an excessive amount of caffeine, as this aggravates the system. They can present with signs of muscle tension, headache, muscle spasms, nausea and vomiting, and inability to speak. GAD can interfere with a person's life, and it's mandatory that they get some form of treatment to abate their symptoms. The next form is called OCD, or obsessive compulsive disorder. This is a type of anxiety where people repeat the same behavior without a reason for doing it. They will keep on washing their hands. They will keep on going to the stove to make sure the stove is switched off. They will keep on going to doors to lock the doors and make sure everything is safe. This is also a pathological behavior and needs treatment in the form of counseling and, when necessary, therapy. Where there is a tremendous amount of stress going on, hypnotherapy works as well. But behavior therapy is the form of choice. Another form of compulsion and worry is post-traumatic stress disorder, or PTSD. This does not only come in those who've been on the battlefield, but any person who's been assaulted, has been raped, has been tortured. All these people can suffer post-traumatic stress disorder. And oftentimes it's very difficult to treat them, but the same forms are used: counseling, therapy, hypnosis, and, if necessary, medication. I hope after this health tip you will stop worrying and enjoy the day. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.